Yeah, I think one of the reasons that I like treating people with MPNs, and I think a lot of my colleagues here do too, is that MPNs really deserve an individualized approach more so than other types of cancer, right? So for a new ET patient, that could be someone who's 30 years old and has a very low risk of thrombosis, but maybe is at a higher risk of transformation, versus a 85-year-old patient who was just diagnosed who is very asymptomatic and just needs a little bit of kind of thrombosis risk reduction. So I think the most important thing for physicians seeing new patients is to kind of figure out what's most important to that patient. Is it mitigating thrombotic risk? Is it mitigating the risk of disease transformation? Is it helping symptoms? And kind of tailoring treatment based on that. And so some treatments we know are better at reducing symptom burden, but maybe less apt for reducing platelet numbers, and vice versa. And as we continue to have more therapies, I think we'll have even more kind of refined and nuanced discussions in that space.